So this is good. Couple things to remember. When it comes to our posture, anything from our feet all the way up to where our head is can affect our posture. You know, our heads can greatly affect our posture, right? They're about the size of the bowling ball. You start shifting it to one side, our body starts shifting to other sides. So we have to remember that everything can affect our posture. When our posture is to the function of our body, and ultimately how quickly it wears out, or if it doesn't. So we're going to try to teach you as many things as we can about your posture. Today, we're going to kind of take the approach of working on your hips more. Now, that unlocking the hips a little bit can unlock position. So anyone dealing with lower back pain, anything in the lower back usually, or in the hips, typically these three exercises are kind of the big three. And if we have time, we can do some extras, or I'll show you modifications to that and things like that. Most of the ones you guys will get to do with me will either be standing or sitting on the chair. We won't be getting on the ground or anything. If I do, I'll just show you modifications myself. Okay. The thing that I want you to continue to remember always when we're doing posture workshops is that your posture affects everything. From breathing to thinking, from hormone production to, you've heard this so many, that's my thing. Digestion. So from everything, from the way we breathe, the way we think, the way we digest, everything is affected by our posture. So the worse we have our posture, the more we can start to challenge the function of organs. To the more important thing is chiropractically is we want your nervous system free of interference. Your chiropractors know that the greatest hope we can provide someone is getting fluid communication between your brain and your body. If it's probably kind of like obvious, but we're not taught this and we don't think about it this way. But if I'm someone who's standing in a upright posture, I'm sending a signal from my brain, down to parts of my body. You could assume that was a pretty smooth path, right? I mean, kind of obvious, because if I slouch or I tilt, just like imagine, my car is going to have to take some twists and some turns. It might take a little more in milliseconds for the signals from your brain to reach certain parts of your body. And from those parts of your body to get back information to your brain. So the more upright and aligned our body is, the quicker the communication can go from your brain to your body, and the quicker your body can send signals back to your brain. Okay? So we try to teach you simple daily things that you can continue to do to allow that communication to happen as freely as possible when you're not getting adjusted. The adjustments themselves are our attempt to reboot the computer. When the signals have gotten kind of locked up or restricted, then we reset the computer. But if you don't help to support the structure that we put in there, it comes back. So that's why it's so important to do these basic exercises. The lower body stretching ones we're going to do today are going to be three main ones. And then we'll kind of dig into a couple others if we have time. The first one I usually like to start with is the psoas stretch. So I want everyone to stand up. Come on up there. Is there anybody on? Oh, yeah.
Oh, yes.
Okay. We should have been doing this for a while.
We've got quite a few.
If you guys need feel a little close because you guys are kind of tight, you can probably stagger each other or come over here. It's fine. We're just standing. There you go. Give yourselves a scoop. You're in the jungle. You can come over here. You can teach me. So the psoas stretch, the hip flexor is so commonly typed for so many of us because in today's society, we're not up walking to the store. We're not gardening. We're not farming all day. We're not running and chasing animals to hunt. We usually sit. We sit a lot more than we ever have. Even an active person probably sits more than their ancestors do. So we sit a lot, which means that the muscles that go actually from your spine, you really get this one. That go from your spine, they come down into your hips. And then you have another muscle that comes in here, goes down, and they come in and they attach. This is a really long muscle. Thank you so much. So there's a muscle that goes and attaches from these parts of your spine here, and it moves all the way into your hip. And then there's muscles on the inside of your pelvis in here, and they come down and meet in the hip. These come together and form what we call the iliopsoas muscle. The iliacus muscle and the psoas muscle come together, the iliopsoas muscle. And that attaches actually in your hip. Now, that muscle, and you can imagine, if I'm seated all day, it gets a little shorter. It doesn't have the same length that it used to. So it gets shorter. So I'm seated, this muscle now went from here to here. And if I sit all the time, then that muscle, when I go to stand up, is going to do something where it can't lengthen, and so it pulls me forward, might slip my hips forward. I might start to do some funny things with my position because that muscle has learned to be shorter. So we got to stretch that out. So you can imagine how we're going to stretch it is probably not like this. We're going to be more upright, right? So what we're all going to do is we're going to stand in a position where we're staggered. So let's take your left foot right now. Let's just all step forward with your left foot, and then take a little bit of a step back with your right foot. Just be careful. Randy, if you need, just make sure to hold onto a chair. It seems okay. The wider your stance, the more it's going to challenge your balance, but the more stretch you usually will get. So we're going to be looking for a stretch in your right hip on this one. So the first thing I want to do is just try to keep your feet, the back foot kind of pointed somewhat forward. It could be like at a 45. It's okay. But somewhat, if you're really tight, you might have your foot out at like a 90, and you're not going to feel this stretch much. So make sure you point that toe forward as best you can. Good. Then what you're going to do is just let your left leg, your knee, bend slightly so that you're sliding forward. Just sliding forward. Good. Now, if you find that your knee's kind of going over top of your foot so far that you can't really see your toe much, then I would tell you to reset and let's take a bigger step forward. A bigger step. Because what I don't want is that knee way over your foot. Okay? Good. So, and then lunge forward. Does anyone feel some pull on the right leg in the front?
Mm-hmm.
Yes. Good. Everyone does already. Okay. Relax. So it's really as simple as just doing that little lunge. Now we're going to give you what I call a pro tip from Dr. Nate. Hopefully they clip this. Stephanie, clip this now. Anyway, the pro tip. The pro tip is this. Number one is that you want to make sure you're feeling the stretch in the hip. But if you don't feel it a lot, or you want to intensify that hip stretch, I'm going to show you how to do that. So everyone, try to go back in the position you were. Make sure you really split those legs as far as you can, within reason. Okay, and then do a little stretch and just lunge forward. Does everyone feel a little bit in the front? Mm-hmm. Now I want you to try this. This is kind of hard. You're going to take your tailbone. Imagine your tailbone gets tucked underneath. So you're going to do what we call pelvic tilt. And pelvic tilt, sometimes it's hard to do that, but you're going to contract your lower abs, and then you're going to tuck that tailbone under. You feel an increased stretch with that? You'll kind of feel that. So if you can tighten and tilt, you're going to feel really stretch. That's the money right there. Okay, relax. Because what you're doing is you're actually engaging your abs. You're learning how to work your abs in a different position, but you're getting that muscle and really stretching it right where it needs it the most. So the pro tip is that pelvic tilt, right when you're in that stretch position, you tuck that tailbone under. It's not an extension of your back. I want everyone to be careful. If you're in a position where you're here and you're trying to get more stretch, I don't want this. You might get a little stretch, but what we really want is the tuck. So keep this tight and lined up, but the alignment's huge, and lunge forward and tuck some more. Okay? If you start to try to get more and do this, you might hurt yourself. Then you'll come in like, some of my patients will try this and think, my back really is killing me. That stretch wasn't good. Maybe we just weren't doing it really well. That's why we do these. That's why we show up for this stuff. So everyone just go to the other side for a second, do a little stretch. I'm just feeling so tight on the other side now. Stretch that. So just everyone's get a good lunge, step forward. Remember, ear over shoulder, shoulder over hips, and just a slight lunge. Your whole body should be coming forward when you stretch this. It's not an extension or yoga stretch style. It's just there. Everyone try to tuck that pelvis, just tuck. Do you feel a little bit there, baby?
I am.
And just tuck that pelvis.
You're very out of shape.
I feel like the truth keeps hitting you.
Yeah.
You feel a bit more. But let's relax it out. Those are the simplest ways to stretch the psoas muscle. You guys can all have a seat. We're going to do the seated one. You guys can let your psoas muscles shortly. I'm challenging myself. If I fly off this, it'll be good for the video.
Oh, yeah.
I should guess someone else. So the second stretch, most important thing we can do for the hip. So what we did, we focused on the front of the hips, right? From the hips, it's a lot of stretch. There's a lot of muscles here. You realize in your hip that there are, really that affect your hip, probably over 14 muscles. Easily over 14. I should have looked up the exact number, but easily 14. There's a good handful in the front here, and then we're going to now start to work on the hip and the back and the glute area. Okay, so there's muscles that we call externally rotate our body, our hip. There's ones that internally rotate our hip, and there's ones that flex it, and there's ones that extend it. Today, we're going to work on the ones that flex it. We just did that. Now we're going to work on the external rotation. When your hip is restricted in any range of motion, it can start to lead to more arthritis, just like the disc in your spine. When you're subluxated and your body's restricted, it's not moving really well, then the discs in between those two bones, they don't get good nutrition. Same thing happens with joints that are too tight. They don't get good nutrition. And nutrition goes to your joints by movement. So the law of movement is so vital. And on the first Tuesday of the month, we talk about different laws. One of them is movement. But if we don't move the joints and allow them in their full range, you start to lose that range and arthritis will form. Same thing with the joint is this. You can kind of dehydrate or wear out because we're not moving anymore. So we want to make sure we're moving it out as much as in, as much as all of these guys. The back of the glute muscle, we want to stretch in a very simple way is we're going to take, and depending how tight you are, you can even start with the leg maybe even out like this. So your left leg out and your right leg, you can even just, some people, you might just put your right leg on top of your left one and just try to sit up straight. Now, some people may feel a little stretch in their glutes, maybe a lot of you won't. But if you can get your back really straight, you might feel a little bit. Now, the next step would be to bring that the ankle up on top of the knee so that you're kind of, and if that's really tough, then you can kind of manipulate this bottom leg, right? So if like I'm really tight, I might drop the leg back here. I might kind of bring it in front. But if you can, ideally it would be like this. Figure four upright. There we go. Now, what the pro tip on this one is it's not about necessarily kind of pushing this hip down, although that's good. It's all about keeping your upright, your torso, really upright, head over the shoulder, really good alignment. And then I'm going to lunge at the hips. I'm going to bend at the waist, and I'm just going to lean and tilt forward, not flex forward. Go ahead and relax your organs. Do you guys lose a little bit of stretch? Do you feel like a little less pull there? So when you get up, you're already stretching more. And what you're going to do then is you're going to try to lean your chest into your thigh or your shin, but you don't lose the curve in your lower spine. So just come forward. Just a lunge forward. Try to keep that head up, right? Very good. Do you feel that? You don't feel that? You want a little more of a stretch, or you like more flexible? Like curves here. You can tilt, you can push with your toes, kind of pick your toes up and then lean a little more. That'll get you a little more of a stretch. You feel that? So if you're like, I want a little extra pressure and I can't really lean, I'm trying to keep good, just push with your toe. Pro tip, push with your toe up a little bit. You're going to get that glute out there. Good? Let's try the other side. Anyone knees bothering in that position? There are definitely modifications. Some people, you might not be able to put the ankle all the way on the knee. You might put it past it a little bit and try to almost pull the knee towards you and come forward. Yes, you can try it if you want just for a test. Instead of going there, you can kind of hear him lean and pull. And sometimes that it gets a little stretch, but this is probably the ideal. Everyone kind of get that position. Remember, upright and moving forward. I can tell a big difference. Does anyone feel a big difference side to side? It's look pretty. Mine's really different. And that's a problem. So anytime you find one side is like way tight compared to the other side, that asymmetry is a big red flag, and be careful. So if you're like, well, hey, I can do all kinds of stuff. I'm still pretty active. I can run. I can lift weights. Know that your body's compensating to that tension. And you want to talk to me about it. We might want to get you into a massage therapist or some rehab exercises, because one side being much tighter than the other side is a bad deal. That can lead to injuries and problems. That's why I'm focusing my hip mobility right now, because it's so bad. So left side, right side. Big key. Lunge or hinge forward. Keep upright, and remember, you can always push your toe up to get a little stretch. Okay? Good? Feel all right there? If there's any questions that you guys have, just type them in on there. We're going to get back up. Yes. Everyone stand back there? So, work the front, work the side, is some side. Now we're going to work the back, the hamstrings. A lot of people will say they feel they have tight hamstrings because most of us stand in a position where our hips kind of slide forward, our hamstrings get tight, and we lunge this way. And so sometimes our posture is causing that tension, but our hamstrings really aren't that bad. It's actually some of the other things we already did. We fix those, your hamstrings might get in better position. But most people do need to start to stretch those puppies out because again, as we sit, our knees bent, which means it shortens this long thing here, it gets shortened. When we sit, because our knees are bent. So we need to stretch those too. What we want to focus on with a hamstring stretch is very simple, is we still want to practice that kind of hinging instead of just like, I can do that. Now, does that stretch my hamstrings? It does. But what I want you to do is focus on the slight lunge here. And that's how we're going to stretch this. So what you're going to do is really trying to keep us curved, a little bit of a curve in your low back. You can almost put your hand on the front and the back and try to maintain that postural position. So you don't want your spine to feel like it rounds, So if I'm going like this and I feel a lot of rounding here, my stomach's crunching together, you're not doing what I'm asking. Okay. I'm asking you to stay real tight. Your abs don't move and your back doesn't move. You just start leaning. Usually we get to a point where you're like, oh, okay, that's pretty good. Right? You're not necessarily touching the floor right away. Now, well, we all have our hands there. I want you to practice a breathing. Is everyone okay? You can stand up if you need to. I want you to try to breathe in, but push your belly into your hand, your lower belly. Big booty belly. You're pushing right in and tightening up. You're expanding if you want. And then when you breathe out, set that belly button right to the spine and try to drop a little thing. Breathe in deep again. Air into the nose, into the belly. The belly's tightening up like you're trying to burst your belt. And then you breathe out and you suck this belly button right to the spine. You're tightening that in. You might be able to go a little further. Good. Everyone come up. If you feel that it's hard to hold that spinal position, you might just kind of focus on the ceiling, or like where the ceiling meets the wall. And you just kind of keep looking at that. Like keep your head up and just drop down. So you're like, okay, that's about it. That's another way you can do this. Because I guarantee you, if you keep your focus high, you can all try that. If you keep it high, it's really, I guess you can kind of round, but only to a certain extent until you let your head go, right? Mm-hmm. But that's one way to cue you into that flattening of your back. All right? One place still. So what I was doing in the end there was teaching a little bit about the breathing, contract, relax a little bit. And you can do that in any of the exercises we just did. So if you're doing a hamstring or the psoas stretch, you could breathe in or tighten in right here. And then I breathe out, sucking it in, and I go a little further. I breathe in and then out and go a little further. What's good about this? Number one, you're getting breath work done. Breath work helps calm our mind, it strengthens our abs, and it also starts to coordinate movement and breathing, which is necessary for a healthy body. You also can use it as a counting mechanism. Because I will tell you, if you do 3 deep belly breaths, 3 to 5, you probably did your 30 seconds of stretching. So people ask, how long do I need to stop? 30 seconds is great. You can go to a minute if you want. But the more that you hold the tension on that muscle over time, and maybe you're breathing and relaxing and breathing a little more, relaxing. But doing that over 30 seconds to a minute, maybe even 2 minutes, if you want to get there, you're going to see changes in the length of your muscle. I used to play sports with all this. You might back up. All right. Yeah, stretched. I guarantee that just might like fired your brain to say, oh, that was good. It does very little to change the tissue. All right. Changing the tissue takes time under tension. You're going to change ligaments in your body. That's why I put you on those tractions for up to 10 minutes. We have devices now that we can take you, give you a home. You have to be under tension for like 10 to 20 minutes, research shows. And for the muscles, we don't have to hold you there that long, but a minute or 2 or 3 is awesome if you can. But the breath work would be a good way to count. Start with 3 breaths, maybe go to 5, maybe start doing 10. Maybe start doing retention breathing, like Wim Hof breathing. You breathe in, you try to hold your breath for a while. Great. Do whatever you want. Just don't pass out and hurt yourself if you're blaming. Or you guys want to sit down. Actually, good. So if you want. But breathing and stretching, huge. There are some things you can look up if you'd ever like to, if you want to get into this. It's called contract, relax stretching. It's where I would be contracting a muscle, then I'm stretching and now relaxing and get more into a stretch. I will show you, we might need to move that because I'm going to show you guys on this thing. So if you're really looking at doing some more stretching for the body, one thing that I would definitely recommend, I'm going to use this right here first, is calf stretching. And we can't really necessarily do it easily, but the calf
like most people's calves are just way too tight. They're way tight. And there's two muscles to your calf. And we're going to show you kind of a simple way to do both of them. I have you stretch your calves on the exercise, on the vibrations back here because it's so vital. But if you're doing it at home, I would put your foot way up on a wall. We call this a pro stretch. Your foot's going to be way up on the wall as far as you can with your heel on the ground. And then I'm going to take my hip and I'm going to try to touch the wall. If you can touch the wall, I'd like to meet you. I would come over. You might. I mean, heck, there might be some people, but you're going to try to push that hip to the wall as close as you can with your foot as high as possible. All right. Basically, if you touch your hip, that means your foot somehow goes like that. But you're going to do that again. Set a time, take some breaths. What would be contracting? Well, I would actually be pushing my toe into the wall. So it's like I'm trying to push the wall away from my toe for like a couple seconds, and then I relax, and then I push it a little further. So like I could probably touch my hip if I do this a couple times. Now my foot's starting to stretch down. But if I'm pushing my foot into the wall. Like I'm trying to push the wall away. Then I relax it again and I go a little further. It's called contract, relax. With the psoas stretch, it's a little tougher. I'm not going to really get into that, but that's one way. I definitely dirtied the wall. That's one way to stretch it. The calf, one very valuable thing is not just keeping the leg straight when you're doing this, is actually to try to then bend your knee and touch your knee to the wall. And you're going to get a different muscle. I think everyone should stretch your calves every day, along with those other three that I showed. But if you're going to do three, do the three I showed and get into the calf. But we're just stretching here and here. What's this? I find a lot of people are also coming with a lot of quad tension. I found that one exercise that if you can get it down to the ground, will be really valuable for you. But what you're going to try to do with the quad, a lot of people have stretched the quad, maybe even just kind of bring it up on like a table and trying to come up. This is also psoas, but a quad would be where I can grab my ankle like this. I would put it on something and try to pull it. Some people have no chance of getting their ankle. That's okay. You could try. If you have bag enough pants, you might go grab your pants at first. Maybe like a bungee cord or something where you can bring your leg up this way. If that seems tough, you could try this other variation of quad stretching. I like this. I like to get myself onto the ground. I'm going to lean forward. And so if you're not that flexible, it's okay. You're going to lean forward and you're just going to try to get your foot onto the wall. You guys can come over here if you want to see it, because I bet you can't see what I'm doing. I don't have any other better walls. So you're going to try to come out back here. And if you're real flexible, you're going to try to get your knee as close to the wall as you can. Okay. But if you're real inflexible, you just get your foot barely on a wall. And then what you're going to do is you're just going to start to sit. You're going to start to come back. You're going to have like something to hold you. And you start trying to push your thigh back to your heel. Okay. So like, I'm going to show them just so they can see. So let's say I'm here. So I've got lots of room here. I'm going to put my foot there and then I'm going to just push back this way. And that's a great way. It's really, I'm really feeling that stretch. And I'm getting my psoas a little bit. If you want an extra little stretch in here, up for a challenge, then put your foot, fully flex this way, and then just keep pushing back. And this is one where you can contract. I'm gonna pretend like I'm kicking my leg into the wall, like I'm kicking down, and I'm feeling my quad contract, and then I relax, pushing more. It's a great psoas and quad stretch. Well, everyone could really benefit from that one too. So those are some extras that you can look. The only other muscle. I got 5 minutes. The only muscle that we didn't talk about would be our inner thigh. Our adductor muscles, that's where we hold all of our feet right together. So you're really, really tight in there. You can learn from a young age to just hold your feet. And so the butterfly stretching, people might sit down and do. If you're like, I was in class, I remember as a young kid, I almost had a lot of fear. I couldn't do that crisscross applesauce. I had no chance. My knees were like almost up there. So the adductors, though, are so huge in a lot of processes. The simplest way I'd probably tell most people to stretch them would be just like a simple side lunge. Just like this. Just this one. There's a million ways you can butterfly sit. But just if you're trying, you just want to, again, keep an upright position. Or just lean. You can feel pull there. But that's the other muscle that really haven't touched. And that's so tight that pulls your hips out of position for most people.
The stretching is wonderful. If you really wanted to work the legs more, I would tell you that the combination of stretching with some tissue work, which would be like using a foam roller, lacrosse ball, you could get into some of this and like really work out the muscles. That would be great. I have not done one of those workshops. I probably should at some point. To teach you guys like how to work out some of these things on the foam roller. But the stretching is wonderful. Tissue work helps to unlock that patterns of dysfunction. And also you still need to be strong. So no, we're trying to stretch out our legs to help our back. Good. We're working out some of the trigger points. Good. But ultimately we still need to be strong. And so some of the other exercises we'll give you about strengthening up in your hips, your back, that kind of thing. So when it comes to proper posture, healthy functioning body, we need to have the ABCs. We need good alignment, which I was trying to teach you on almost all of them. Head over shoulders, shoulders over hips, hips over ankles to some degree. That's your alignment. B is balance. Balance is huge. We do a whole class just on balance, but any of these things I showed you kind of require some balance. Not all of them. But balance is key to healthy posture. But even just one-legged stance is really good. Brush your teeth and try to stand on one leg. So that's my thing. The last is core strength. So if you want good posture, you want a healthy body, you have to have good core and then strength around it. But the core is huge. That's what we're kind of practicing until only with the exercises. Just trying to hold your body in a good position and leaning helps you maintain good core. When you breathe, the belly breath, I'm working the core. A weak core has a hard time doing belly breath. We breathe, it's all up here. If we breathe in, we don't have any strength down there. So working all these pelvis motions will help your back, help your body. Ultimately, my hope is that I teach these things not just so you guys know them, but that you can share it with other people. We want more people to be less sick. And if we can get more people less sick, you can drive down the road and not see so much road rage. You'll see people that are, actually helping each other and doing some of the things that we talk about on the fourth Tuesday of the month. There's this tomorrow, or not tomorrow, next week, we're talking about being selfish versus generous. What does that even have to do with chiropractic? Well, I tell you, chiropractic has to do with the whole person. And we're going to remove interference from your body and your mind. We need to work on the mind too, because your body holds again. Like I said, fear. We talked about fear a couple of months ago. So I should have showed them that stretch. No more. But we're always going to give kind of like the polar opposites, fear and faith, those kinds of things. So know that we want to serve you and teach you, and the fact that you guys are here and engaging, you're learning what you can. There's people that aren't, but share it with people. It helps you to learn it. You're involved in it. Do these things. So just try to get some of these done to help. If you need handouts, we have them. If you go to a blog post on our website, I think I have a little video of me doing all three of those. Let me forget what I said.